see. All right, it's being recorded. Okay, I want to thank everybody for coming and attending the training for the Canidae Corporation. And I'm going to let Erica start first so she can tell us a little bit about the group, because I guess they have a few different divisions, and then we'll get right into the training.
Okay, thank you, Andrea. Okay, so basically there are 4 companies that are basically put together under one or umbrellaed under one policy, which the main company is Canidae. They are a pet food manufacturer and distributor, but then there's also Tappet Brewing that's in San Luis Obispo, and they are a beer brewing company. Ethos, I'm not exactly sure what they do and where exactly offhand where they're located. And then there's also Caltex, which is like a freight company. And what it is it's all commonly owned, and that's why we were able to consolidate all of them and umbrella them under one policy with Canidae. So that's where the divisions kind of lie, and that's why, you know, some of you, like I think, I don't know who exactly is going to San Luis Obispo, but just kind of keep in mind that there's no, I mean, other than there's common ownership, there's nothing else that they do that's common. So just always kind of keep that in the back of your mind, and it is really important when you do talk to the employees, if they're calling into the call center, that you do find out what division they belong to. So that's pretty much it.
Thank you. That's good to know. And so Patrick's going to be the one that's going up to San Luis Obispo. So Patrick, you'll be going to the beer brewing company. And
that's just what I was going to
ask. And Susie will be going to Northville, which I guess
can I interject real quick, Andrea?
Sure.
On that note, I just want to, I spoke to the contact over in San Luis Obispo today, Matt Dolman, really nice guy. Just make sure, because we're going to be doing the group meeting, Patrick, they're going to call in from 10 o'clock to probably 11 o'clock. So if I were you, I'd try to get there maybe like probably 11:15. Just because nobody will be downstairs, he said, and what will happen is, like, you'll just be shut out. You'll just be standing out there. So kind of try to push it a little bit past 11, just so you're not sitting around.
Okay, but they're doing group meeting, right?
Yeah, we're doing it telephonically, though. Like, so they have to go upstairs, I guess, away from the front area to get on the phone call, and that's the phone call I'm going to be on. Unless, well, there'll be a Colonial rep doing that call too, because Mike, I think, actually is going to be on that call. So it's not really necessary that you're on it. Yeah. So, yeah, Mike, I think he already got that covered. I'm actually positive he did. So there's no need for you to actually be there for that call.
Okay.
Yes, I'll double check with Mike just to be sure.
Is there a number that is there a number I can call into to listen to that?
Yeah, I think that one is, yes, I can go ahead. If you send me what I'll do is I'll send the call-in numbers to Andrea, and then she can just distribute to you guys as she sees fit, if that works.
Okay, great. Yeah, I'd love to be able to just at least listen in.
Okay, yeah, no problem.
It helps when he does the one-on-ones if he knows what was addressed in the group meeting. So yeah, that's really important. And then a lot of the remote people, the Texas people, Clarice Frazier, Clarice Mims, and Dana's team, you will be receiving the calls. They're going to be given the flyer and the instructions with the call center number to call in, and they're asked to call in as soon as possible and not wait until the last day. So hopefully that will happen. All righty, so let me just start with the guide, and then I'm trying to close that, not open that. All right, so let me start with the guide, and we'll just go through the guide. I received the census, and the census had some employee socials and some employee numbers. So, and I had to set it up with employee IDs because if I don't have a social for everybody, then it errors out. Because if so, you'll see some, you know, some of the socials are there, and then you will need to collect the rest of the information from the employee. They did pretty good. They got us pretty much the census that we needed, but there will be some missing parts that you'll have to collect when you sit with the employees. The dependents who are currently on the medical insurance, they are also added, but we did not have dependent socials, so you will have to collect the dependent social. And Erica, have the employees been instructed to come with that information, you know, their dependents, date of birth, and socials?
Yeah, I think actually it was, wasn't it on that flyer that you created for the benefit counselors? I think I saw it on there.
It should have been. So hopefully they'll do it. But
well, what I can do too tomorrow morning, previous to the group meeting, and so I can just, you know, we can talk about that to make sure that, you know, that they have all that information. All of those people are pretty much in-house, and I think it won't be difficult to obtain that information. You know, it's not like they're all office staff.
Okay.
For the most part.
Love it. Okay, that'll work then. Alrighty, so then we have, I'm going to look a brief glance at the benefits right now, and then we'll look at them in more in depth when we go through the benefit guide, the benefit booklet for the group. They have 3 medical plans that are available in California: the Anthem Blue Cross HMO, the Anthem Blue Cross HSA, Luminos HSA plan, and then the Anthem Blue Cross Solutions PPO. And of course, for the employees that are out of state, they cannot have the HMO. The HMO is just for California, and it's labeled California. So and I'm trying to get it set up as best I can so it doesn't get offered to anybody outside of California. But I'm still working on the census since I had that today, and I should have it done later tonight. And then they have 1 dental insurance plan, a PPO plan, of course, and it's the same plan as last year. And then the Guardian Vision plan. Vision is new this year, so employees hopefully will be excited to get Vision. And then the Basic Life that is an existing plan as well. We're conducting this enrollment like Thrive. Everything is going to be electronic. And since there is not a voluntary life buy-up, there's not an EOI form that has to be filled out. So there should not be any paperwork that needs to be filled out. We'll just capture all their elections electronically in Harmony. If in California, if on the HMO, if they don't want to collect, if they don't know their provider number or they want it auto-assigned, is it okay if we write the auto-assign again, Erica, for the HMO?
Yes. Yeah, that's fine.
Okay. Okay, cool. Alrighty, so that's why I don't really have any core paperwork instructions, because we're hoping not. And the booklet, the rates that are in the booklet are what you will see in Harmony, so we'll see those when we get to the booklet. And let's see. And just like we usually do, you're going to need to, especially on some of the employees, you're going to have to collect their Social Security number and any other missing information. So be sure to collect all their information and the dependents information. If you have any issues, call me. And we'll have Erica's number in here as well, because if you have any questions on the plans, just like we did with Thrive, you'll be able to reach out to her office to get any answers. But it's pretty standard, pretty clear. So I don't think there'll be any issues, but we always want to have it provided in case it's needed. And remember to have the employees sit next to you so they can see your screen, not across from you, and they're the ones that set up their password, so that it will be their electronic signature. And let's see, we have some of the waivers on there for the ACA, and so be sure that they complete those so we get the signature on those benefits as well. And I will pass out I will get to you the pre-enrollment flyers. And Erica, I do have new ones for you. I know it's probably too late, so we finally got the URL for the UVille site, so the UVille site is up.
Oh, okay.
It takes a couple, yeah, and so I'll add that to the flyers and send them to you. I'm sure that, but at least anything that you pass out from now on, at least will have the correct UVille site instead of the generic one on the flyer. And so I'll get that to all of the benefit counselors and make copies so that if you need to, with those that are at actual sites, so that you can pass them out to employees if needed when they're there, so that they have something to look at. The current existing benefit choices, the medical and the dental choice, is going to show under the existing benefit tab when you're in the enrollment screen. It won't show on the enrollment screen to carry forward. You will have to select it again so that the plan that the employee wants this year will show, and the correct premiums for this year will show on the election form. All right, now in the colonial notes here, we have group disability that we're offering, and I just needed to make a notation because we have multi-states that we're offering. Colonial doesn't allow me to set up a plan twice, so I can only set the group disability at 1%. So it's set at 60%, so the employees in Texas and other states that don't have state disability can get sufficient disability. But that means those of you in California, any employees in California, you'll need to take their monthly salary and figure out what 40% is, and don't let them get higher than that amount, because we don't want them to get higher than that amount. Now I put in the guide the schedule so that you can see when all the divisions are having their meetings, and you can see that some of them are telephonic and some of them are going to be in person, so that the call center, you'll know when employees will start calling you. It'll be after they've finished the telephonic calls, telephonic meetings. And I think the telephonic meetings are they all on the 18th, or there's one of them that's going to be on the
tomorrow. 15th. It'll be after the group meeting. There'll be one for ethos tomorrow, and then there'll be 3 on Monday.
Okay. And is Mike doing the telephonic one tomorrow
I
as well?
I believe he is, or I think it was someone by the name of Dana. I know that
Dana.
He knows about.
Okay. Dana helps manage our call center team.
Yeah, I think he was, because he couldn't do it one day. I'm not sure if it was Monday or if it was tomorrow, but I actually was hoping that maybe one of the benefit counselors at Susie that will be in Norco tomorrow with me.
Mm-hmm.
Maybe she can just she can just speak at the meeting briefly.
That's fine.
At the via the phone call, like at 2 o'clock or whatever.
Okay. Yeah, I just want to make sure we're going to get all 15 done in one day. If we're starting at 10:30, I'll leave it up to you, though.
Would you be able to go back on the 18th if you needed to, Lee?
No, I'm not. I could on the not Tuesday if I had to.
On Tuesday you could go back if you needed to?
If I needed to. Because we're starting late to begin with.
Or if you could check with Mike to see maybe if he can get on that call.
Yeah, I'll double check with him after he gets back from his doctor, and I'll ask him which days he's doing it.
Okay. Let me ask you that. Can I ask you a question, though? Because it says a couple of things. It says group meeting 4:15 at 10:30 a.m. And then it also, like in the pages down, it says 9:30 and 10:30. So what's happening tomorrow? That's what I really want to know.
Tomorrow is a group meeting at 10:30, and then there's going to be another division that's going to call in. That's going to be a group meeting, but it's not going to be anybody that we did the initial group meeting for in Norco. They're going to be calling in, and then we're going to do another one at 2 o'clock.
Oh, I see. Okay. So it's just like what we did at Thrive, right?
Exactly.
Yeah. Okay. So that's just what I'm thinking is if that goes for at least an hour, and with me at the end or whatever is fine. So you're really talking, then people go to lunch. So, I just want to make sure that we've get your people done, that's all. Okay, but I'll be prepared to do the GM at the 10:30.
Okay.
All right.
And Andrea will find out from Mike about the 2 o'clock. So.
Yes, I will. All right, and then everybody who meets with the benefit counselor knows about Mike's folders and how he likes them, to be sure you have the brochures that the employees need, and the taxability benefits and the service guide and Mike's survey. Those that are on the phone is a different story. And then I have this one in here because at one time they did list 9:30, and so I'm just going to take that out, Susie, so it's just at 10:30 at the meeting.
Thank you.
Yeah. And then, Patrick, now I can put this in here now that we know that you're going to be here April 18th, 2016 and the meeting is at 10, was the meeting at 10:30 or 10 o'clock?
No, the group meeting's at 10.
Oh, that's right. It's on the phone.
It's on the phone, yeah, and then he just needs to come after that.
Right. And the phone meeting, the phone meeting is at what time?
10 to 11.
10 o'clock.
10 o'clock. 10 o'clock.
And I sent you the invite on that, so you could forward the phone number to him.
Okay. And so, Patrick, so you know that you're not going to get in the building until after 11.
Not a problem.
You and Jeanette. All right.
I'll be in the brewery waiting. No, just kidding.
Now up here with your schedule, I didn't see any meeting for Caltex. Is Caltex having a meeting at all?
Well, it's going to be, I think that they just meshed them in because Caltech only has like one person, I think, or two. So I think they just put them into the other one. So we have them all covered. But
okay, you have them all covered. Okay.
Yeah.
Got it. Okay, so then we're good. All righty. All right. So Erica, I don't remember if I had your I know you gave it to me once before. I think I don't have it here. Is this your cell phone number or not your cell phone number?
That's my office, and it does, if I'm not there, I don't pick up, it goes into my cell phone, but I'll give you my cell phone just in case.
Okay.
It's 949-294-8566.
There we go. So we have Erica's cell. All right. So these plans will be effective the 1st of May. The premium effective date for the colonial coverages is the 20th of May. They're 26 pay, and as you can see, when you submit business, you need to select the correct section, because Erica talked about different departments, and so they have the marketing and the sales and the ethos department, the office, the Tappet Brewing, and the Caltex Freight. So you will have to ask, and I will put this, add this to the classification so that you see what, or I'll make it a location so that when you are enrolling employees, you can select a location and it will be what their section is. So it'll be easy for
Andrea?
you to submit your visit. Yes.
Ethos is not like Canidae, so you can take out like the Canidae-ethos.
Okay. I was just going from what I received. So ethos is just ethos.
Yes.
Okay. There we go. All right. All right. So like I said, we're offering the 3 group products like we did at Thrive. The group disability, keep it at 40% in California, but you can go up to 60% out of state. The group accident, we're offering the 2 plans, the Plan 1 and the Plan 3, the on and off job accident with the $50 health screening. And then we're offering the group medical bridge plan with the $1,500 and the $2,500 hospital confinement benefit, and the option 1 for outpatient with health screening. So remember, and this time the flyers were correct. The first time it mentioned the health screening benefits that don't belong to the group products. So none of the employees should be confused with this one about the health screening benefits that are available.
Okay.
Yeah, and then now we're down to the core benefits, and so As you can see, two of the benefits, the plans they had last year, the HMO in California and the HSA plan, and they added a new plan this year, that the Solutions PPO 2000. So I think I'm going to open up the guide now so that we can go over all of these plans with Erica, so be sure that you understand them. Alrighty, so here we go. We're on the HMO plan. Erica, well, I'll let you describe the plans to us.
Okay, this is a typical HMO plan through Anthem Blue Cross. It is a scaled down network, so just keep in mind that when they do a doctor search with you, or if they do a doc search with you, that when you go onto Anthem's website, that you're selecting the Select Network plan. If you have any issues with that, like Andrea said earlier, feel free to contact me or the helpline that we'll show you at the end of this guide, and we can also walk you through or get that information for you or for the employee. So with that being said, this does have a deductible, which is a little bit different than most HMO plans. It's got a $2,000 per person. The office visit copay is $30, $45 for a specialist. That is not subject to the deductible, but any type of diagnostic testing, lab work, anything of that sort would be subject to that deductible. The maximum out of pocket is $3,500 for an individual, $7,000 for a family. So if anything catastrophic were to happen, that's the most that would come out of their pocket in a calendar year. Once they've satisfied the deductible of $2,000, inpatient hospital is then 20% up to the annual out-of-pocket maximum. Same with outpatient surgery. Preventive care, like all of the other plans that we've discussed previously, is covered at 100% due to healthcare reform for initial screenings. Emergency room is a $150 copay plus 20%. The $150 is waived if they are admitted, so keep that in mind. Prescription drug benefits, there is a brand name deductible associated with that particular tier. It's $250 for an individual, $750 for a family on a calendar year basis. So once they satisfy that deductible, they then would get the $40 copay or the $75 copay for the non-formulary tier. Generic, there is not a deductible associated with that tier, and it's only $15. And that's it for that one.
Okay, and then we have the HSA 3000 plan.
Okay, this one works for those of you that were dealing with Thrive. This is a very similar plan to their plan. Just keep in mind that the company does not sponsor a health savings account, so it's the same setup as Thrive, whereas they go out and they have to get their own HSA account. But it does give you that option. It's a $3,000 annual deductible in-network for individual, $6,000 for family. Out-of-network, you see that it's $6,000 individual, $12,000 for a family. The out-of-pocket limit is $6,000 individual, $12,000 for family. Out-of-network, $10,000, and then $20,000. So when you go down here, at the primary care physician is $30 copay in network and for specialists and PCP, and then out of network it's 30%. But if you scroll down in the in network, you're going to start seeing it's at 0%, and so is outpatient surgery. That means that once they satisfy their deductible, basically they, for those particular benefits, they don't have to pay anything at all.
I can't understand you right now.
Erica,
you can't hear me?
Something happened here. There we go. Now
okay.
I can hear you again.
Okay, where'd you lose me at?
The 0%.
Oh, okay. So what that means is that once the deductible is satisfied, that they do not pay anything towards the contracted rate, okay, for those particular services. And then out of network, it's 30%. The preventative care works exactly the same way as the HMO in-network, but out-of-network, they would be responsible for deductible and then 30% coinsurance. The emergency room is at 0%. Of course, you have to satisfy the deductible first. The prescription drugs are all subject to the medical deductible, and then once you satisfy the medical deductible, the generic is $10 copay, brand formularies a $40 copay, and non-formularies a $60 copay. Just to let you know, most of these people are familiar with this plan. This plan has been, I want to say this is going to be the third renewal for it, so you shouldn't have too many questions on how this works.
And they can get an HSA, but they can have this plan without having a health savings account as well, correct?
Yes, that's correct.
Okay. And then the new plan.
Okay, so the new one you're probably going to get questions on, and this is because, you know, so they're probably going to be interested in this even though it's going to cost them more money. Some of them have griped about, you know, obviously the deductibles that are associated with the HMO and the PPO plan, specifically the PPO plan. So, you know, this definitely, these plans are good for your gap coverage, so I would really try to sell that with these guys because they all have these high deductibles and whatnot. But with that being said, this is a new plan. The annual deductible, it doesn't have an HSA. It's not an HSA compatible plan, so you can't have an HSA with this. The deductible is $2,000 for an individual, as you can see, $4,000 for a family. Out of network, it's the same thing. The out-of-pocket limit is $4,000 for an individual, $8,000 for a family, and then $12,000 and $24,000 out of network. Primary care physician is $20 in network, and then 40% out of network. And then obviously once you satisfy the deductible inpatient and outpatient, you pay 20% in network, 40% out of network of the contractual rate. Preventive care, again, is covered at 100% for initial screening. In network, out of network, it's 40%. Emergency room is $150 plus 20% coinsurance. $150 is waived if they're admitted. This plan does not have a brand name deductible for the drug, so it's just a straight generic $15 copay. Brand formulary is a $40 and non-formulary is a $60.
You there? Anybody have any questions? Anybody have any questions on the medical plans before we move to the dental?
And hold on, let me.
Oh.
So I think it's per person now, but let me.
Because that was always the scary thing. They love the HSA, but it's so scary if there's more than one person. You know, and I thought maybe that was an Affordable Care Act rule.
Mm-hmm.
We want to look at the HSA again, or?
For the out-of-pocket, you know,
yeah. I'll have to. We can move on. I'll have to research that and find out where that email is at, because I know that was the draft.
Oh, okay. Okay. Thanks.
Okay. Erica will provide the answer later.
Okay.
Mm-hmm.
All right, so then we'll move on to dental then. The dental, it's the same plan that they had last year, the PPO dental plan through Anthem. So Erica, if you want to explain this plan real quick.
Sure. It's it's the traditional PPO plan, $1,500 annual max, meaning that's the most that they can, the Anthem will pay out in a calendar year, and that's per enrolled member. The deductible is $50 for an individual, $150 for a family. It's waived for preventive. If you go in and get your cleanings twice a year in and out of network, it's covered at 100%, but just keep in mind that you will be subject to balance billing out of network, so they would have an additional cost. And then preventive care, or I'm sorry, basic services in network is covered at 90%, same as out of network. Major services are covered at 60% in and out. This does have an orthodontia benefit, 50% up to $1,000 lifetime maximum for children and adults.
And so most of the employees are going to know this plan as well, since it's the same plan, and you'll see the employees who currently have it under existing benefits. And if they want to keep it the same, you just add it again down so it'll print on the election form with the dependents they want to cover. But they are offering a new plan this year. They're offering vision. So Erica, if you want to go over the vision plan.
Sure. It's with Guardian, but it's actually VSP. Guardian's just billing the VSP product. So the copay is a $10 copay. Materials is a $25 copay. They can go and get an exam every year, lenses every year, frames every 24 months. Lenses are covered at 100% after the material copay of $25, and then you can see out of network, that's how much would be covered based on whatever lenses they decide to get. Contact lenses are $130 allowance if elective, and out of network it's $100 of them would be covered. Frames is $130 allowance, and out of network $46 it would be covered.
So it's a standard VSP vision plan, but
yeah,
it's something new, so hopefully the employees will be happy that they can have vision insurance. My whole family uses glasses, so I'm always glad to have vision. And then they have the basic life through AD&D. That's for all. Is it for all full-time employees, whether they get medical insurance or not, or just for those who get medical insurance?
Everybody gets the life. That's why everybody needs to be accounted for.
Okay, so because we want to update beneficiaries and everything, this one is, and I didn't get any information on who currently has the life. Everybody will need to select the life, and we will get updated beneficiaries for everybody.
Anthem, and they do have, who has it.
And it's through Anthem, and it's a $25,000 life and AD&D policy. And then we can see here what the monthly, this shows monthly deductions, and it's not broken down to the per pay period amount, so they can see the monthly amounts that they pay. And I didn't get another benefit booklet, so it's the same cost whether they're in California or out of state. Is that correct, Erica?
That's correct.
Okay. And then you can see the dental and the vision costs here. And the dental and the vision are totally voluntary. The employee pays for the cost themselves, but you can see on the medical, the employee-only coverage is paid for on the HMO and the HSA plan. And they buy up for their family members, and they buy up to the new PPO plan. Does anybody have any questions on any of the core benefits, the medical, the dental, the vision, the basic life?
No.
They're pretty straightforward. And then the benefit booklet has, all the disclosures. So everybody has one of these. So all the new disclosures that have to be covered. And then I think it was at the last page that has the information. Are they going to be getting they'll be getting the plastic laminated card?
No, they don't get it. They're not big enough.
They're not big enough?
So you can just, they don't, we don't make enough on them to to do that for them. But
tell them to take this page off and put it on the refrigerator. Yeah, then.
Exactly.
But they still have that helpline available if they have any questions. They just have to keep track of the number.
Yes.
Okay. All right. Does anybody have any questions on any of the benefits?
Eric and Susie, are you going to have the benefit booklets there?
Yeah, there's only going to be about 20 at that Norco location, but yes, I will be bringing them, hard copies.
Okay. All right.
Okay.
And do they have hard copies up at San Luis Obispo?
No, they sent everything out electronically at that location. Okay.
So Patrick, you may want to have one printed of this benefit booklet so that you can refer to pages. Okay.
Yeah, I'll do that. I also have the PDF in my computer to show them as well. But yeah, the booklet is good to have. I'll print a booklet.
Okay. Alrighty, let me go back to the guide real quick. And so we went over all the plans, and I think there's really no. Can you think of any other instructions we need to give Erica? Otherwise, I think.
No, I think that's it. I mean, other than we just these guys are really nice. It's just mainly about when you do go out to the locations. We'll have Jason, who's he's like the head of everything, which will be at Norco. And then, like I said earlier to Patrick, there's going to be Matt Dolman and San Luis Obispo, and those are basically, you just need to tell them, Patrick, what needs to be done. I already spoke to him today, so he understands that everybody needs to meet with you there. That's in that office. So he's already working on all that. So just let him know what you need to have done, and I'm sure he'll accommodate it.
Okay.
I was going to say I don't have a number for the SLO location. Can you send a phone number so I can have it in the guide in case for any reason that Patrick needs to call?
Hey, I can see if I don't even know if I have a number. Oh wait, you know what? I do actually. Hold on, let me give it to you right now.
Okay.
You there?
I am.
We're waiting.
Okay,
we're waiting.
I know. Hold on.
That's okay. That's why I said if it was easier, you could just email it to me and I can add it.
No, I have it right at my fingertips here. It's 805.
805.
762 4016. And that's Matt's cell phone.
That's
cell phone. Okay.
I didn't get it all. 805?
762 4016.
Okay, got it.
Okay.
Okay. If nobody has any questions, like Erica said, this training was going to be quick and easy, and it was.
Yep.
Call center, just be prepared. The employees are being instructed to call in. So we hope after these meetings on the 15th, the webinar meetings on the 15th and the 18th, you should start getting calls on this group. If nobody has any questions, I thank you all for attending, and I will send an updated guide out in shortly. Everybody already has the benefit booklet and the plan summaries, and as per usual, the plan summaries are already loaded in the Doc Center on Harmony as well, and they're also loaded on the, I'm going to go, I got the UVille address today, so I will double check to be sure I gave them all, to be sure they're all there, but all of them should be on our UVille site as well. So be sure to have that site pulled up to show employees when you're there, because it's always cool to show employees the site that they can go to see about their benefits. And let's see, I think that's about it. And I thank everybody for being willing to assist on this group.
Okay, and Andrea, you're going to email me the call-in number, right?
Yes, I'll email that to you so you can call in on that call, awesome. And I will also double check with Mike to be sure that he's going to be the one conducting these webinars, or who's going to be conducting them. All right.
Okay.
Thank you, everybody.
Thanks, guys.
Thank you, Erica.
Thank you. Okay, thanks.
All right.
Bye-bye.
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 Bye.
Bye.